Today I'd like to talk about a problem many people have encountered yet often don't know how to deal with loose teeth. As the saying goes, a toothache is not a fatal illness, but the pain can be unbearable. What's worse, loose teeth are even more distressing. Just imagine, while eating, a tooth wobbles in your mouth like a loose screw or flickering candle in the wind. You dare not bite or chew, for even the slightest touch brings piercing pain. A sip of cold water sends a sharp tingling sensation through your teeth, like an electric shock that makes you shudder all over. Hot food leads to swelling and soreness, leaving you too afraid even to drink soup. You can only chew slowly with the other side of your mouth. Only those who have experienced this know how miserable it is, robbing you of appetite and peaceful sleep. Many people around me suffer from loose teeth. Some recover after a while with no further trouble and to get back to eating and drinking normally. For others, the condition worsens gradually. One loose tooth turns into two, then three. Eventually, a whole row of teeth becomes loose like falling dominoes and has to be pulled out. This costs a lot of money and brings prolonged discomfort, making it hard to eat properly for months. So, what exactly should you do about loose teeth? Are there effective treatments? Today, I will explain everything in detail, hoping to help you avoid detours and unnecessary pain. Let's first look at the causes of loose teeth, which vary from person to person. Some cases result from trauma. You may trip and fall face down, hurting your mouth and bleeding heavily, get hit in the mouth by a ball while playing sports, or bite down hard on a bone while eating, which instantly loosens a tooth. These impacts strain the periodontal ligaments around the teeth, causing looseness. Periodontitis is the most common cause, especially among the elderly. Signs include inflamed, swollen gums and bleeding while brushing your teeth. As time passes, gums recede and the alveolar bone gradually resorbs. Think of the alveolar bone as soil and teeth as trees planted in the ground. When soil erodes, trees tilt and become unstable. Exposed roots mean trees topple easily in the wind. The same goes for teeth. Another cause is apical periodontitis, an infection and pus build at the tooth root that forms a swollen bulge like a balloon. X-rays will show a dark shadow beneath the root. This also leads to loose teeth and throbbing pain when touched. Loose baby teeth in children during the tooth replacement stage are a normal physiological change, just like autumn leaves falling naturally. Do not worry, pull or wiggle them manually. Let them fall out on their own. Now let's move on to treatments. I have summarized 6 methods for you to choose from based on your situation. Nonetheless, always consult a dentist first. Leave professional work to professionals. Do not guess or tamper with your teeth yourself, or a minor issue may develop into a severe problem, costing you teeth that could have been saved. First, tooth splinting. This method uses dental appliances to bind the loose tooth to adjacent healthy ones. The healthy teeth share the chewing fourth, allowing the loose tooth to heal and stabilize. It is like propping up a wobbly fence post with extra wooden stakes or supporting a wind-bent young tree with a stick and rope until it grows straight again. Improper splinting, however, is risky. Poorly fitted appliances can damage healthy teeth, making them loose or infected and causing permanent harm. Always visit a regular hospital and an experienced dentist. Never opt for cheap roadside clinics. You will only waste money and suffer needlessly. Second, tooth extraction. Most people dread tooth extraction and put it off for as long as possible. Yet some teeth are severely decayed down to the roots, with advanced periodontitis and nearly depleted alveolar bone, just like a stick stuck in soft mud. Such teeth serve no purpose and endanger surrounding healthy teeth. Inflammation, bacteria spread rapidly. It's like a rotten apple spoiling the whole basket. In this case, extraction is the best solution. A short, sharp pain is better than prolonged suffering. Removing the unsalvageable tooth protects the rest of your teeth and restores oral health. You may consider dentures or dental implants afterwards according to your budget. Note that extraction must be done in a formal hospital when inflammation is fully controlled, never during an active infection. Third, maintain good oral hygiene. This is especially important for parents. When children's baby teeth loosen unnaturally, do not wiggle. Yank or force them out with tools. This may damage the developing permanent tooth buds and lead to crooked or impacted adult teeth, a lifelong problem. Simply keep the mouth clean by brushing twice a day and rinsing after meals, and let baby teeth fall out naturally. For adults, proper daily oral care effectively prevents most periodontal diseases. 4. Regular teeth cleaning. Many people misunderstand teeth scaling, believing it loosens teeth and widens gaps. This is completely wrong. Teeth scaling removes tartar, relieves gum inflammation, and keeps teeth firm. Tartar, similar to limuscale inside a kettle, is hard, yellow, and impossible to brush away. It irritates gums, causing bleeding, recession, and bone loss, which eventually loosens teeth. Removing tartar regularly is like weeding a field. With reduced inflammation, gums and teeth become healthier, and bad breath fades away. It is recommended to have your teeth cleaned once or twice a year. Temporary tooth sensitivity after scaling is normal and will disappear within a couple of days. Inflammation control. Acute attacks of periodontitis or apical periodontitis cause sudden tooth looseness and severe throbbing pain, like being hammered repeatedly. Some people also develop fever and swollen cheeks. Inflammation is the root cause, and looseness is just a symptom. Dentists will perform root canal therapy or periodontal treatment to clear infection, drain pus, and remove dead tissue before applying medication to reduce swelling and pain. Once inflammation subsides, teeth will tighten up again. Painkillers only mask symptoms and cannot cure the problem. 6th, anti-inflammatory medication for traumatic looseness. For mildly loose teeth caused by trauma with no displacement, you may take antibiotics such as metronidazole or amoxicillin under a doctor's guidance to avoid allergies and drug resistance. Do not chew with the affected tooth and give it time to recover. It will gradually firm up as inflammation fades. If the tooth is severely loose, displaced, or nearly fallen out, seek emergency dental treatment immediately. The dentist will reposition and splint the tooth, combined with medication and good oral care. For the first 1 or 2 months, stick to soft, cool food like porridge and noodles. Normally, the tooth recovers fully within 1 to 2 months. Even after recovery, avoid hard foods and let the tooth adapt gradually. A special reminder: loose teeth are not terrifying, but neglecting them is. One untreated loose tooth will affect adjacent teeth, triggering a domino effect that may cost you an entire row of teeth. See a dentist promptly for a correct diagnosis and targeted treatment. Do not endure the pain silently or try unproven folk remedies like vinegar soaks or garlic compresses. These irritate gums and worsen the condition. Above all, prevention is better than cure. Develop good daily oral habits. Brush your teeth thoroughly morning and night, cleaning every surface, including the uneven back molars where food debris accumulates easily. Use dental floss to clean gaps that toothbrushes cannot reach. Mouthwash can never replace brushing, as it only washes away surface food residues but cannot remove dental plaque. Just as rinsing a pot with water alone will not clean it thoroughly. Get regular dental check-ups too. Do not wait until pain or looseness occurs, as it is often too late by then. An annual oral check-up and teeth cleaning cost little, but save you from huge medical bills and suffering later on. This is especially vital for the elderly, since healthy teeth contribute to overall well-being. That's all for today's talk about loose teeth. Our teeth are essential for eating and accompany us for a lifetime, so we must take good care of them. Wish everyone strong and healthy teeth, good appetite, and great health. See you next time.